Hello, dear aquarist, dear fish health manager, and all those who want to keep fish in a good condition and following my cases on fish diseases. And I share here today my next video on cases of fish diseases number 103 about the Colisa lalia, called Trichopodus lalius neon today. Showing an abnormal behavior, body damage, very weak, and we had losses. They were dying. And as you can see here, this fish was in very bad shape. The fins are already falling apart. The very skinny, very weak. Well, the fish was very in a stressed modus. Here we see from the top. You see how skinny it is. The fish. Well, these fish were dying, and the whole lot of fish which were imported by an importer were suffering very badly. So we start to do an examination on the skin. We couldn't find anything particularly. The gills looked very reddish and inflamed. You can see how thick they look. That's not a healthy looking gill. We did a dissection of the organs. You can see the dark reddish organs. Here we took them out. You see how dark and reddish they are, very, very special looking. Also here, you see here the kidney in a specific darkening coloring. So we examined it in the microscope, and we see the organs are very poor condition. You know, they're very reddish spleen, very black areas in the liver, very irregular liver, very looking bad organs. And here is the kidney. See the dark pigmentation inside the blood clots, and well, very abnormal organs. And this is something hard to define what is really causing it. You're checking internally, and then you check the internal fluid. And we saw a bunch of different bacteria, and you see also those white transparent things here. That's the sperm, because it was a male dwarf gourami. And that's the whitish specks here, and the black spots in between, that's the massive bacteria. So we saw some bacterial infection also in this fish. So what can you suggest or conclude? What can we conclude for this dwarf gourami? Well, certainly put the badly sick fish in a separate quarantine tank, because we suspect that this might be a viral infection. There is a particular virus called Iridovirus, which is common in this species, coming from Asian breeders. And there's not much you can do, and the fish is already in such a bad shape. When the immune system of the fish is reacting perfectly, in good condition, he might overcome the viral infection. But when it's also bacterial infection and stress involved, well, it's complicated. Well, you can try to do a treatment for this secondary bacterial infection, which is most likely here in this case. And some people try to use Oxytetracycline as a treatment, 10 grams for 100 liters. This is a high dosage. Some people had good luck with that, but ask your fish doctor. He might have a better opinion on that. We recommend feeding with a healthy food, a functional fish food, like our professional biofish food, to treat and the herbal for at least 20 to 30 days. And you can put the fish asleep with a tranquilizer, like Narcomore Plus, which are suffering badly. But check with your supplier. You should try to get better dwarf gouramis, which are available these days. And try to get more information from my books, which are helpful in getting you a better training in fish diseases, giving you more details with many more photographs. So I hope this helped you and that you stay informed. Also with my Patreon, you can follow more training on fish diseases. So I hope this case of fish disease helped you again today to become a better aquarist. Thank you for watching.